Your patient has coronary artery disease. The provider prescribes an 81 mg aspirin every morning. Why? It isn't being prescribed to treat pain. It's being prescribed to help prevent a blood clot that could block a narrowed coronary artery and lead to a heart attack. So, why are we giving it? Aspirin is commonly prescribed for patients with coronary artery disease, after a heart attack, after coronary stent placement, and for certain patients at increased risk of stroke. Now let's talk about what it actually does. Aspirin is an antiplatelet medication. Think of platelets like tiny pieces of Velcro. Normally, they stick together to form a clot and stop bleeding. That's a good thing when you have a cut, but in coronary artery disease, plaque has already narrowed the coronary arteries. If platelets stick to that plaque, a clot can form and suddenly block blood flow to the heart. Aspirin makes those platelets less sticky. Less sticking means fewer clots. Fewer clots mean better blood flow to the heart. Now let's think like a nurse. Before administering aspirin, assess for signs of bleeding. Ask about a history of stomach ulcers or gastrointestinal bleeding. Monitor for unusual bruising. Assess for black tar-like stools. And always verify that your patient does not have an aspirin allergy. Now, what should you anticipate? When aspirin is working, anticipate a lower risk of clot formation, improved blood flow through the coronary arteries, and a reduced risk of heart attack or stroke. At the same time, anticipate an increased risk of bleeding because platelets are no longer sticking together as effectively. Now here's your NCLEX alert. The biggest complication associated with aspirin is bleeding. Watch for bleeding gums, easy bruising, black tar-like stools, coffee ground emesis, prolonged bleeding, or any signs of internal bleeding. If your patient suddenly becomes dizzy, hypotensive, develops black stools, or begins vomiting blood, recognize the pattern. Stop and assess your patient. Notify the provider immediately. Now here's your signature key. ASA keeps platelets apart. Less clotting, more bleeding. Remember that one statement, and you'll remember the most important nursing implication of aspirin. Know your meds. Protect your patients. Because nursing doesn't have to be complicated. Let's make it make sense. Nursing success starts here.